Are COVID-19 vaccines causing the rise in long-term illness? Or is this just another anti-vaccine myth? We're diving deep into groundbreaking research that reveals the surprising truth tonight. The data might shock you. Good morning, Twisted News viewers. I'm Theo Shaft, and tonight we're tackling one of the most debated topics of the pandemic era. Some claim that COVID-19 vaccines are to blame for a surge in chronic health conditions. But does the science back this up? Let's break it all down. In the UK, the number of working-age adults with long-term health conditions has jumped from 31 to 36% since the pandemic began. Over 2.5 million people are now unable to work due to chronic illness, an increase of more than 400,000. These numbers have fueled speculation, with anti-vaccine advocates pointing fingers at the vaccines instead of the virus. But new research is challenging that narrative. A recent study published in JAMA Dermatology analyzed over 6 million medical records in South Korea. Its findings leave little room for doubt. COVID-19 itself, not the vaccines, is driving the rise in long-term health complications. The study showed that COVID significantly increases the risk of autoimmune diseases like Crohn's, rheumatoid arthritis, and Behçet's disease. Here's what the numbers tell us. Patients who contracted COVID had a 35% higher risk of developing Crohn's and a 45% higher risk of Crohn's disease. Now, here's the part that might surprise you. For unvaccinated individuals, these risks skyrocket. Take Sjogren's syndrome as an example. For vaccinated individuals who caught COVID, the risk increased by 13%. But for the unvaccinated, it jumped to a staggering 76%. And for conditions like psoriasis, the study found no increased risk if the patient had been vaccinated. The conclusion is clear. Vaccines aren't causing the rise in chronic illness, they're preventing it. Without vaccines, millions more would be facing debilitating long-term complications, and countless lives would have been lost. Professor Rob Galloway, a healthcare worker with Crohn's disease, shared his experience. After contracting COVID twice, he saw his condition worsen. The evidence is undeniable for him and many others in the medical community. Vaccines are a critical tool for reducing COVID-19's devastating long-term effects. That's not to say concerns about vaccine safety should be dismissed. It's natural to question the long-term data, especially with something as new as the COVID-19 vaccine. However, as Professor Galloway points out, the benefits far outweigh the risks for individuals and society. So what do you think? Do these findings change your perspective on COVID vaccines? Or do you still have concerns about their safety? Let us know your thoughts in the comments below. As always, stay curious, stay critical, and keep questioning. I'm Theo Shaft, and this is Twisted News. Until next time.